Hi everyone, my name is Ollie. I'm a final year medical student at the University of Warwick. I'm delighted once again to be collaborating with the MDU, the Medical Defence Union, to be bringing you this video. And they've asked me to talk to you today about trying to make the most of our clinical placement during the pandemic. This has been an extremely challenging time for medical students everywhere, not just in final year. Clinics have been cancelled, elective surgeries postponed, and most medical wards are becoming rapidly overrun with COVID patients. But there are still a few things that I've personally found quite helpful, and that's what this video is going to be about. So number one is about going in with specific goals. This has always been good advice, but now more than ever, I've found going in each day with one or two things that I want to achieve really helpful. Because clinical exposure is so limited, it's perfectly reasonable that you might only see one or two patients face to face in a given clinic, or the one or two patients on a ward round that don't have COVID and are more appropriate for you to see. So we need to make the most of these opportunities for contact if they do appear. For me, for example, I know a weak area is murmurs, so every chance I get to listen to a patient that has a known murmur, I try and get the registrars or the consultants to go through exactly what I should be hearing and practice hearing them for myself. Just making sure that we get every last bit of learning out of each clinical encounter. The second thing is, I suppose, trying to be a bit more flexible than we normally would be, because we need to keep in mind that things are not normal, they have not been normal for a long time, and they will not be normal for a long time. I know that many of my medical student colleagues really like having a very good plan and a rigid routine that they like to keep to every day, and knowing what's going to happen on a given day when they go in. Unfortunately, I just don't feel like that's the world that we live in right now. Clinics are cancelled, procedures are being postponed further and further, and teaching opportunities are being lost with very little notice. Now, this is frustrating, but obviously the staff that look after us, that run the wards, are under an immense amount of pressure, and that's not just doctors, that's all types of staff. And I think that one of the things we can do as students within reason is try to be as understanding of that as possible, and that's not to suggest for a moment that anyone isn't, but we are not the ones that are bearing the brunt of this right now. I think we just need to try and hold out, and things will eventually get better. Yes, it's frustrating, yes, it's annoying, but we all just need to kind of come together, hold out, and things will get better. And then the last thing is that, as ever, communication is really important. If you're really struggling to get those teaching experiences, which many of us are, the easiest and best thing to do is make sure that the right people are kept in the loop. That's your medical school, your administrators, your personal tutors, because these are the people that have the clout to get things done and get things reorganised. Because educational staff still have a duty to make sure that we're getting the training that we're supposed to be getting as well as they can do, because at the end of the day, we're all going to be F1s soon in my year, which is terrifying, but not just for our sake, for the sake of the patients that we'll be seeing as new junior doctors. We do need to have as much exposure as we can get, even under these limited circumstances. So keeping that good two-way communication open and rapid is going to be the most practicable way to make sure that we're not missing out on things where things are available. So that's it from me, guys. Thanks for listening, and thank you to the team at the MDU for asking me to get involved in this project. It's always a pleasure to work with the MDU. If you haven't used them as a resource for your medical student society or to seek advice, I would strongly recommend doing so. They are a great bunch of people, really supportive. I've had a lot of luck with them personally in the past, and they've got a load of really good helpful advice for medical students and junior doctors on their website, so go and check them out too. Take care, guys. Thanks.